news you can use.
I'm Louise Thompson. I'm the Executive Director of Tampa Bay Community Network, a public access television station in Tampa, Florida. Today's segment is going to be on lead poisoning prevention, and we welcome Cynthia Keeton from the state of Florida's assigned to Hillsborough County's Health Department. Welcome, Cynthia. I'm glad you could be here to talk to folks about lead poisoning prevention. And after just a minute break, we'll be right back and find out more news you can use on lead poisoning prevention. Welcome back to The Scoop, giving you some news you can use with Cynthia Keeton from the Health Department, who's going to talk to us about what she does in lead poisoning prevention. Cynthia?
Yes, to talk to you about my program, everyone who knows me, they call me the lead lady. So they know that this is my passion, that I love being the advocate for children. And that's what I protect children. I protect them from the harms of environmental factors. And right now, my program is centered around childhood lead, which we know that any pre-1978 home may compose lead poisoning for children, which will cause a hazard, and they become lead poison. And that's the thing that we're trying to prevent. By 2010, we're supposed to have eradicated lead poisoning throughout the United States. We're nowhere close to it, but the lead levels have dropped. What is childhood lead poisoning? It's when children that are under the age of 6 touch things because they have that hand-to-mouth contact. We call it pica, where they put things in their mouth. And especially when they're on the floor, they're touching the floor. If it's an older home, it's the dust that's coming off of the painted walls if they have been disturbed. A house is safe while the paint is intact. If the paint is not intact...
If it gets scratched?
Yes.
Or a piece of furniture chips it or something like that while you're...
Yeah.
It's a problem.
It's a problem. It will start emitting off dust. Long years ago, it used to be where kids would peel that paint off and eat it because lead has a sweet taste. So it gravitates children to go back to that same source of where they got the lead from. Windows are a prime example. Children like to look out the window, and when they're looking out the window, most of them, their mouths are right at the windowsill.
Oh, sure, because you have to make those little vapor steam things so that you can ensure that your mouth actually works and you breathe hard on them, right? So they got their mouths right up against them.
Right, and while they're doing that, they have a tendency to mouth the windowsill. If it's lead-based paint, you might see some little teeth marks there, or they might begin to just put their mouth on it and suck the dust off. And this is how they get elevated blood lead levels. And we're talking about a particle that is so small, as small as a match head, will cause a child to have an elevated blood lead level or 10 or greater.
Let's talk about before we talk about prevention, what the problem is if you have lead poisoning. What happens?
Well, what happens is the child begins to, it depends on how long the lead stays in that particular child's body. Each child is different. So once it enters that body, it goes into the bloodstream. It'll lay in the stomach for a while, and then it'll go to the bloodstream.
This is not something that just expels like everything else you could chew on? It just stays in your body?
If the children eat well, it will expel through the body, through the urine and the stool.
Okay.
That's the safe way to get it out.
But if they're not eating well, this is a problem. Okay.
That's the problem.
Okay, so if it sits there, what happens?
It begins to travel through the blood system, and the first place of attack is the brain. We're talking about soft tissues, your neurological organs. These are the areas that lead will come in. It diminishes the IQ level for every level of lead the child has absorbed. So if it's a 10, It's minus 10 with that IQ level. If it stays in that child's body too long, you start seeing irreversible problems. Behavior, hyperactivity. It can lead to death. It can cause learning disabilities, aggressive behavior. We see a lot of kids who want to fight other kids. Their attention span is not there. If they're in a regular classroom setting, it's difficult for a teacher.
Could they be misclassified as, because so many children are being classified as AHDH now, right? Could they be classified as that, and it could have been the result of the lead poisoning?
Well, right now, a couple of months ago, and I think that was back in either May, they started diagnosing lead-burdened children as ADHD. And I say they're medically sick because if the lead came from the environment, it medically made them sick to cause their IQ levels to drop.
And their attention span to be off.
Right. But now they are now associating ADHD with lead poisoning
okay.
children.
So I wasn't too far off.
Right.
Okay, so that's a happening. And they can actually die from lead poisoning.
They can, acute lead poisoning. Tampa has been the primary source of where we have all of the strange cases. We were the first one in the whole state of Florida to have the highest lead level. We had a little boy whose lead level came in with a finger stick of 125. Remember, I said 10 is considered lead poisoning. When he went back in and had a venous draw from the arm, it came back 95. That was still high. That's death door in some cases. The little boy ate well, so that helped him a whole lot. And on top of that,
How did he get exposed to that much? Is that, it's not really that much? Is it a small amount really, but it's just he's not able to get rid of it in his body?
some children can digest it and it expels quickly. Then you have those who don't, and it stays there. And what happened, we believe what happened with him, he was a very active little 3-year-old who climbed on things, and the house was peeling, chipping, and chalking. Besides the peeling, and with him being in the window all the time with his little dog, this is how he got the lead poisoning.
You said earlier that 1978, all homes built after 1978?
Before.
Excuse me, before 78. So is a person safe if it's after 78 or not really?
Yeah, they're safe even if it's before 1978.
Okay, but
If
but the odds are greater if the house was constructed before 1978.
Right. And then, too, if the paint is stabilized and intact, you don't have a problem. When you disturb it, like renovation work, and you don't know what you're doing, you might want to take out the window, put in a new one, you create lead dust. And who gets it? The children.
So, what I'm interested in is, are children automatically now, I know that pediatricians do enormous amounts of testing on children these days. Do they automatically test for lead?
Only Medicaid children are tested.
Okay.
They're the only ones
I want to know more about this. We'll be back in just a minute and learn more about lead poisoning. Welcome back to The Scoop, hoping to provide you with real news you can use. Today we're talking with Cynthia Keeton, who is a childhood lead poisoning prevention coordinator and specialist, otherwise called the Lead Lady. Before the break, I asked you about testing. This only is done.
Medicaid children are the only ones that are required to be tested.
Why?
Because most of the time, they're the families that live in dilapidated housing, poor housing. They're the ones who are going to go into those older homes, and where the homes are not stable, a stable environment, a safe environment. And this is how most of the children get lead poisoning. And it comes from when landlords don't understand the hazards that are in their homes that they're renting. And that's one of the things that we're trying to work with landlords to do that.
Are you trying to also work with pediatricians to do testing? Because the earlier the testing, the better off you'd be, wouldn't you?
Right. CDC, the Center for Disease Control, says the child should be tested at 12 months. The first test should be at 12 months. The
Okay.
next one should be at 24 months. If they miss the 12, they got to do it before the 24th month of that child.
That's a requirement of
That's-
all children?
That's a requirement for Medicaid
Only
children.
Medicaid?
But it's
That's
a
on-
requirement for all children to be tested at that age if they are living in a pre-1978 house. Now, all doctors know that they have to test for lead. We have a zip code that we target older houses based on the census that says these are the houses and these zip codes that might be pre-1978. Might be a 1950 home.
Okay.
Okay?
So, how are non-Medicaid children getting testing? Should the parent watching this ask for it?
Oh, yes. That's one of our recommendations. A parent have to ask for that. It is not something that a doctor readily gives. But based on the fact that we have gone to pediatricians and told them that these are the zip codes, when that child comes in, that doctor's supposed to automatically look at that zip code, and it will tell him this child needs to be tested for lead.
And one hopes that that is being followed some way. You're here in Hillsborough County, but are there lead poisoning prevention coordinators from the state of Florida in other counties in the state of Florida?
Not in all. What they do will, most counties will work with their epidemiologist to do the screenings for lead, and then they will find someone in the environmental health office of the health department to go in and test the houses if they have a child whose lead level exceeds a certain amount.
Okay. So the reason that they put you in Hillsborough County is because we have some high levels, do you think?
Yes. Tampa, Hillsborough County has a 27% housing stock that is pre-1978.
20% of all housing, 27% of all housing is pre-1978?
Yes.
Wow, with all the building we've done, you can't imagine that.
Well,
Okay, plus a lot being renovated, and
Right.
that's where the problem lies. Okay.
Yes.
So, in terms of prevention, what do you recommend to people when you go around talking to them about this? How can we prevent this from happening?
Well, what I normally do, and say let's take a lead poisoned child. I have to go and do an elevated blood level investigation. The nurse will go out with me, and she will talk with the mom and tell them the medical side of it. I talk about the environmental side. The environmental side, I might see that I'll do a visual walkthrough, and then I might see some peeling, chipping, chalking paint in a certain area. If I'm not going to be using the XRF, I
Now,
will
hold
use...
this up. Let's everybody see that.
This
What's
is the XRF that will actually test the substrate, which is walls or either molding or the window seal. This is what will test and tell me within seconds what the lead level, how much lead is there. It will actually give me a number of how much lead. It goes through every layer of paint until it gets to that lead, and then it tells how much lead is there.
So if there's 10 levels of paint on the wall, it'll
Yes. It'll go
expose that or let you know about that.
Yes.
Okay. All right. So how would you get a call, a referral? Would somebody just call you?
Lead is a reportable disease. All pediatricians have to report it.
Okay.
Okay? Once they report it, it comes to my office.
Okay.
And then we sit down and we send a letter or either make a phone call to the parent. Normally we send letters out that said we will come out and do a free home walkthrough. It depends on where the lead level is.
Okay.
From 10 to 19, we normally just talk about prevention.
Okay.
When it gets to be 20, it's serious, because if it starts escalating, that means it's going to continue. Something is happening in that home that needs to be addressed. That's when we come in with this, and we will test the surfaces to find out where the lead is. We mimic the child's behavior. We don't look at the whole house. Where is this child spending most of the time? Where are the hiding places? Where the child likes to play?
You pretend you're a 3-year-old or whatever it is?
Yes.
Okay.
Yes, I really get down to that level.
Oh,
And
that's
they're-
probably a little fun in a way.
Yes,
Yeah,
it
okay.
is. It is. And usually if I'm out, normally the children are right there too. So I can watch them and see what they're doing anyway.
Where do you typically, I mean, you just talked about the paint and shipping paint. Is that the typical place, the only place? Are there other places that you find lead?
Oh, there's other places. The high spots that we normally know that lead is will be windows, as I stated before, doorways, like you're coming in and out of a home, the threshold part. Children like to stand and put their hands in between the doors like this. Whatever they're touching might be peeling, chipping, chalking paint, or either old porches that are painted.
Okay.
Yeah.
Those are your typical places. What
Yes.
about items? Are there items that are found to be a toy or something like this?
Yeah, well, last year the early part of the year we had all of the recalls.
From China?
Yes.
China. And no one can, having become a new grandmother and going out to the shops to buy, I noticed that I could not find one single toy in all of Babies R Us, not one toy that wasn't made in China.
Right.
And I went to the old standbys, the Fisher Price, the Play School, and all those places I always trusted when I was raising my own kid. And they're all made in China.
Yes.
So have we fixed it?
No,
Yes? No?
no, we have not fixed it.
We haven't fixed it. I want to hear more about this, and we're going to do that as soon as we come. Talking before the break on the topic of toys that were made in China. And you said, no, the problem's not fixed.
Well-
That's scaring me.
Well, you have a lot of parents who still have those toys.
Okay. So new toys, when we're buying new toys right now off the shelf,
They're supposed to be better.
better, but is it eliminated?
I don't know. We don't know.
Because we're not testing. I think I just read an article recently that we get, I can't remember the number, but let's say 10,000 ships come in a week with imported stuff into the United States.
Right.
And we have like 11 inspectors.
Right.
So it's some odd and huge gap between the number of inspectors for any product. So nobody's inspecting them. Is that what we're...
They do have inspectors, and now I think it's much better than it was before.
Okay.
But I do know that some toys are still coming through, not just toys, jewelry that little ones wear, clothing.
Well, I noticed that about the clothing. All the clothing was also made in China,
Yes.
in the whole store. Like Babies R Us,
Yeah.
the whole store.
Yeah.
And there can be lead made in the cloth or the stitching or something.
Well, one year we had the zippers. It was the little thing that goes up and down on the zipper. It was painted.
Okay, yes, we've seen plenty of that.
And Nike had at one time the little red dye around the shoes for little boys.
Right.
The red dye had lead in it. So it could be in a number of places.
So it's not necessarily something like an antique toy,
Right,
which maybe has nothing in it.
right.
I know that you found on coffee mugs.
Yes.
What about lead crystal?
Oh, that's one of the prime things that I talk about is to make sure that you don't use them for consumption. If you are, you got to use it readily. Anything that is acidic that you're putting inside crystal will cause the lead to leach into the
drink or
Yes.
whatever it is?
Yes, yes.
So stop bringing lead crystal for shower and wedding gifts, I guess, huh?
You can use it. What I tell people is to seal it up, put it in that little case, your little glass.
The hutch.
Yes, and just use it for beautification. That's it.
All right. Are there some other places that you have found them? You just talked clothing, toys, jewelry.
You remember Halloween, the teeth that they had The little.
Oh, yeah, the
Huh?
plastic teeth you put
Yeah.
on and then you can eat them, right?
Yeah,
Or
well, not
not
those.
those, the,
The
the wax.
yeah, the ones that had the little gold on them or silver that looked like you had the bling bling teeth.
Okay.
Some of those came out high with lead. And then we found that it could be occupational, where your parents bring it home. Battery recycling plants, incinerators. Those are all avenues that occupationally you can bring it home on your clothing or your shoes.
And you could bring it in, the children it'll just fall on the floor, or you're hugging your child, and
Right.
this will transfer to the child.
Right. Usually they are really excited about their parents coming home.
Okay, well, we're going to talk more about that in just a minute. We'll be back after this. Where can we learn more about this subject?
Well, you can contact CDC if you go on the website, cdc.gov, or either epa.gov. You have the Lead Alliance Network group that you can go online and find them. California have a wealth of information, but we are getting there as being in Florida. If you call the state health office, the environmental health department, they can tell you a whole lot. You can either go on the line with Hillsborough County, and it will take you to the link to Tallahassee, the state health office.
How long are you were talking about trying to eradicate this problem by 2010, and it's not happening? So what are they going to do now for the future to try to speed this process up? I mean, where did that directive come from anyway? Is that a federal directive?
Yes, it's a federal directive
Okay.
that the Healthy People 2010.
Okay.
Same thing applies to healthy homes, which now my program will move into healthy homes. We still will address lead, but we will talk about other environmental problems in the home.
Radon and other things like
Yes.
that? Okay. Are there any regulations coming down that's going to help prevent this, like the imports, or can people be asking for such a thing, legislation?
Yes, well, right now EPA just did a new rule where it will be for contractors who are abating houses. They're going to have to go through a certain criteria for clearancing that house, making sure that all of the lead is gone.
Is that similar to like asbestos?
Yes.
When you do asbestos removal, you have to follow certain protocols.
Right.
If you don't follow that, that's not going to be a problem. Well, Cynthia, I truly appreciate, and I'm sure the viewers do, your wonderful hints, and I hope everyone attends to them, and we'll see you next time on The Scoop.
News you can use.